Hello everyone, now you can see our application, and first of all, to register you need to enter your full name, email and create a password, and you also need to choose your status, patient or doctor. Once you've successfully created an account, you need to fill in your details, your full name, age and gender. After, you'll need to fill out your body metrics, your height and also your weight. The most important part of the registration is your diagnosis. You should select the date of your last surgery, your diagnosis, and write your medical history. Further restrictions: you can choose which allergies, chronic diseases, dietary restrictions you have. After you log into your account, you see a dashboard. You can also see messages from your doctor, reminders, and AIs that can describe your condition. We're moving to the next page, Food Diary. You can track your meals and get AI-powered nutrition insights. And also you can see how many grams of protein, fat, and carbohydrates you consumed per day. The next page is reminders. Here you can set time-based reminders for things like taking pills, going to the doctor, or meditating. You can also choose how often you want to do these things, and you can also track which items you have completed and which you still need to complete. There's an AI that can recommend reminders based on your condition. Moving on this page, you can note the symptoms you notice throughout the day. Furthermore, if you can't type, you can record your symptoms with a microphone. You can also rate the severity of the problems that bother you and assess your overall mood of the day. And afterwards, the AI will give you some tips and explain your symptoms. The last thing is your profile. On this page, you can see all the information you previously filled out during registration. Now we're on the doctor's account where the previous patient was assigned. The doctor can track the patient's condition, their concerns, problems, and symptoms, and monitor their progress, whether they're improving or worsening. The doctor can also see what the patient ate during the day, whether they are meeting their calorie intake, and what procedures the patient has completed today and what they need to do. Furthermore, the doctor can send messages to the patient with advice, recommendation on nutrition, and monitoring their condition.
Our end users are post-oncology patients. We tested the app at a private hospital and collected feedback from oncologists. Based on that, we added red flags to AI prompts for safety, introduced voice input to ease data entry, and added a doctor's message feature since 60% of patients wanted direct feedback from their doctor.